Skin cancer is the most common cancer in the US, and with it being Skin Cancer Awareness Month, we wanted to get the facts on what you need to know. Joining us now is Dr. Arianna Rodriguez from the Southwest College of Naturopathic Medicine. Doctor, thank you so much for being with us.
Good morning, Erica. Thank you for having me.
First off, why is skin cancer awareness so very important?
In the US, more people are diagnosed with skin cancer each year than all other cancers combined, meaning that 1 in 5 people in the United States will develop skin cancer by the age of 70. The more that you know about it, the earlier it is caught, the better off you'll be.
Now, many people have avoided annual checkups during the pandemic. Why is it so important to see the dermatologist during this time?
Yeah, so dermatologists are going to perform really thorough full body skin examinations. They're going to check for not just any cancerous lesions, but they're also going to check for any precancerous lesions. They're able to look in places that we're not always able to see or that we might not always think to look in.
Now, doctor, skin cancer is one of the most preventable forms of cancer. Can you tell us why that is?
Yeah, so the reason for that is that there are several risk factors for skin cancer that are environmental or lifestyle risk factors, meaning that they're modifiable and avoidable. They're things that we can do to reduce our risk of developing skin cancer. One big one is decreasing our amount of UV radiation by just decreasing our sun exposure. Reducing inflammation in the body by increasing our intake of antioxidants and antioxidant-rich foods. Smoking cessation is also a really good way of reducing inflammation in the body. Avoiding indoor tanning and indoor tanning beds. All of these things are ways that we can reduce our risk of developing skin cancer, which is why it really can be a preventable form of cancer.
Absolutely. So tell us, how important is sunscreen and what should we be using?
We know that it can reduce the development of actinic keratoses, which are kind of known as these precancerous lesions, and it can also reduce the prevalence of skin cancers. When you're choosing the type of sunscreen that you want to use, you want to look for something that is broad spectrum, meaning that it gives you UVA and UVB radiation protection. The types of sunscreens that you're looking for are going to contain zinc oxide and titanium dioxide. These are inorganic flocks that are going to provide you protection from the sun. You also want to look for sunscreen that is water resistant. If you're going to be swimming in the ocean or swimming in the pool, looking for sunscreen that is at least SPF 30 all the way up to SPF 50 is going to be your best bet for the type of sunscreen that you're looking for.
Now, doctor, is there anything in particular that we should be keeping an eye out on our skin that might be an indicator that something is wrong?
Yeah, so when you go to the dermatologist, they're going to talk to you about the A, B, C, D, E's of melanoma, and that's kind of the checklist that we run through for any lesions that we think might be suspicious. So A standing for asymmetry, B standing for borders, C is color, D is diameter, so anything larger than 6 millimeters or about the size of a pencil eraser, and E is for evolution, so how has the lesion changed?
Now, Dr. Rodriguez, any final tips or advice that you have for us?
Yeah, so, make sure that you're doing your own skin checks. If you are going to be out in the sun, make sure that you're covering up, wear a big fancy hat, make sure that you're wearing sunscreen and remembering to reapply.
Awesome. Such great information. Thank you so much for your time and for being with us. If you'd like more information, head over to the website.